All right, good afternoon, and thank you so much to all of you who made the trip to Cooperstown. We're delighted to have you with us. My name is Dr. Tommy Ibrahim, privileged to be serving as the President and CEO for Bassett Healthcare Network. I'm joined today by our stellar team, Network Director of Pharmacy Operations, Kelly Rudd, as well as our Physician Executive for our Bassett Medical Group, Dr. Joe Sellers, who both have just been doing a phenomenal job in the response effort that we're all here to talk about today. It's interesting, this time last year, the World Health Organization was about to declare COVID-19 a national public health emergency of international concern. That declaration, the World Health Organization's highest level of alarm, actually occurred nearly 1 year ago on January 30th, 2020. Here we are 1 year later, and despite the toll that this virus has taken on our country, and despite how tired we all are and the impact that this virus has had on our lives, there are still many things that we are very thankful for. And first and foremost, I want to be the first to acknowledge our doctors, our nurses, and all of our frontline staff and caregivers across Bassett Healthcare Network. I can't say enough about our caregivers and practitioners across Bassett who have stepped up in incredible ways for the past year. They've sacrificed a great deal to care for our patients and our communities, both personally and professionally, and they continue to do so even amid necessary organizational change. They do this because they believe in the mission and the responsibility that we have to serve this region. We have seen tremendous collaboration both internally and externally. Our own hospitals are working together in ways like never before. And even as competitors, hospitals and other systems across this region are working together to care for the state in ways we couldn't have imagined. Things that seemed impossible before this pandemic now seem doable, and it is again a testament to the strength of our people. Also, as limited as the supply is, we are very thankful to not only have one, but 2 vaccines against the virus available across the country and our health system. This vaccine is finally that light that gives us a glimmer of hope and optimism. Not only were we able to accomplish this in record time, but both vaccines are incredibly effective with efficacy rates of 95% and both with extremely favorable safety profiles. We are obviously very eager and ready for the supply to open up at the federal level and for more of the vaccine to make its way to rural central New York. We're thankful for the staff standing up our vaccination clinics, both for our employees and soon with much excitement for our community as well. And to Kelly, who's done a fantastic job as our network pharmacy director, thank you in leading a very complex effort. Remember, unlike the early phases of this pandemic, hospitals are now open for business. What we saw early on in the pandemic was significantly different, and it actually amounted to widespread shutdown. This was likely due to significant constraints in testing, personal protective equipment, as well as regulatory mandates. But we also saw a significant patient fear factor play into that as well. With many months of patients self-deferring care, we are seeing higher levels of acuity and sicker patients who are not COVID positive. We have also become very skilled at managing both COVID as well as non-COVID patients, establishing dual systems of care to ensure the safety of our people and our patients who need us. This same phenomenon has led to rising capacity issues and staffing constraints. So while we continue to care for patients in the hospital and in our outpatient settings, we are also running tests for COVID and vaccinating staff and community members as necessary. Responding to the pandemic has been an overwhelming and an enormous undertaking, again, for which I'm very proud of our people for. Importantly, Bassett has made tremendous progress vaccinating the portion of the population in our service area initially prioritized by New York State. Over 5,000 healthcare workers, including 3,500 of our own network staff employees, have received their first dose of the vaccination. We are also now working on second dose vaccinations, while also continuing to vaccinate those eligible in our communities as vaccine is made available. Bassett Healthcare Network stands ready to vaccinate as many eligible individuals as possible when the network's 5 hospitals receive ample supplies of the vaccine. Earlier this week, the New York State Department of Health issued an advisory to healthcare providers saying the supply of vaccine continues to become scarcer, and as a result, the State Department of Health is operating on a week-to-week basis. The Department of Health advisory is not the news we wanted to hear, and unfortunately, we have no control over the federal distribution of the vaccination process. It is important in this pandemic to maintain a focus on what we do have control over, however, and that our response to the pandemic and doing all we can do to protect each other. With the public's help, we need to continue advancing those safety measures proven to work during this pandemic. Our network hospitals in the past weeks have been full to capacity with COVID and non-COVID patients. As I mentioned earlier, we're seeing the confluence of a surging pandemic and a significant number of people who have put off necessary medical care because of COVID and are now so sick that they need hospitalization. And while COVID numbers are beginning to trend in the right direction, the number of hospitalized non-COVID patients continues to be concerning. Therefore, that is the other very important message to our community. We implore people not to put off preventive and necessary medical care. We can safely see you in person or even virtually via a video visit if that is most appropriate for your medical condition. And lastly, please continue to physically distance, mask, and use appropriate hand hygiene, and of course, avoid large congregations and gatherings. And now I'd like to invite our Network Director of Pharmacy Services to discuss our vaccination plans.
Good afternoon, and thank you for having me here. I greatly appreciate Dr. Ibrahim's remarks, really setting the stage for where we are in this COVID-19 fight. As he pointed out, the Bassett Network has made good progress in using the COVID-19 vaccines allocations that we have received from New York State. In fact, we have either used or have appointments scheduled for 101% of our initial vaccine allocations to hospitals across the Bassett Healthcare Network. Last week, Bassett Medical Center received a small allocation of the Moderna vaccine, which was part of an earlier shipment but was delayed. We have been authorized by the New York State Department of Health to use the allocation for eligible individuals who meet New York State criteria Phase 1A and 1B of the state's vaccination program. We have also been directed to prioritize healthcare workers within our Bassett Healthcare Network family and within the communities which we serve, and then move to the other states' criteria of 1B for patients and others who fit those criteria. Given that guidance, Bassett will hold a limited vaccination clinic for eligible individuals this Saturday, January 30th, at the Clark Sports Center here in Cooperstown. That will start at 8 a.m. and run to approximately 1 p.m. in the afternoon. We anticipate being able to vaccinate around 300 people based upon the supply of the vaccine available to us. Appointments will open up later this afternoon. There's some technical work that needs to be completed first within the state's scheduling portal that will add the Cooperstown location to those seeking vaccination. Once that is complete, we will put a notice on our Bassett website, bassett.org, and on the network's Facebook page. However, given how limited the supply is and how much interest there is in the vaccine, we expect those spots to fill up near immediately. We are also using some of the allocation, given the state's direction, for some of our sickest patients that meet the 1B criteria. These include our sickest cancer and dialysis patients and individuals in local group homes who are eligible and are at high risk of COVID-19 infection and their complications. It's very important to understand that the guidance from the New York State Department of Health changes weekly, sometimes daily. Currently, we are required to use the vaccine in about a 1-week time frame from delivery. Given that requirement, we do our absolute best to get as many healthcare workers vaccinated in that time frame. and then use the remainder of that allocation as approved by the state in shared governance with our community partners to vaccinate, for instance, those who are greater than 65 or who are eligible under Phase 1B criteria. While we are likewise frustrated with the scarcity of the COVID-19 vaccine, there is some positive news about our experience in vaccinating healthcare workers. With several thousand individuals vaccinated, the majority of the post-vaccination symptoms for the first and second doses have been mild and similar to what we would experience after a flu shot. Soreness at the injection site, possible low-grade fever, and not really anything that should keep anyone from having their vaccination. There are also some updated recommendations for the Centers of Disease Control and Prevention that folks would need to be aware of and could influence when they're able and eligible to receive the vaccine. Notably, anyone who has had a known exposure to COVID-19 should consider delaying the vaccination until their quarantine period is over. Those who have had recent COVID-19 infection may choose to temporary delay vaccination, given that the risk of reinfection is low in the months after initial infection. And this will assist those in the community without immunity having access to the vaccine while supply is limited. Likewise, patients with COVID-19 who have received passive antibody therapy, which is the new convalescent plasma or the new COVID-19 specific monoclonal antibody, should consider deferring vaccination for at least 90 days. And we would encourage those folks to talk with their healthcare providers about the appropriate timing for vaccination. Now, I'd like to ask Dr. Joseph Sellers, our Chief Physician Executive for the Bassett Medical Group, to give us his perspective on the vaccine and where we are in this moment within the pandemic. Dr. Sellers.
Thank you. In my clinical role, when I'm not helping to keep our medical group moving forward, I take care of patients. I'm an internist and a pediatrician, so I take care of young people and old people and everybody in between. And I've been reminding my patients, as well as the clinicians in our group, that we have to be spreading the word, spreading the message that even if you've received the vaccine, you still might be capable of spreading the virus. And so we cannot back off until data shows that we can on wearing our masks, washing our hands, social distancing, avoiding crowds, all the things that we know that have worked so well so far. So again, I would reach out to the community and make that our message. At some point, we hope to reach herd immunity, where we will have enough people from either natural disease or from immunization have protective antibodies, and then the virus will stop spreading. We are all tired of wearing masks and social distancing. I'm tired of alcohol gel and soap on my hands. I'm tired of staying away from my grandchildren. But it's the ticket to beating COVID-19. We know it works. The fact that many people didn't do what they should have done over the holiday season is why the pandemic surged, and why our practitioners, nurses, and others are continuing to put in long days and long weeks battling to take care of very sick patients with COVID-19 in all our hospitals and all our clinics. We can't turn the tide of the pandemic without the public's help. In addition, I would echo what Dr. Ibrahim has said regarding assuring you that your preventive medical care of chronic conditions, despite COVID, needs to go on. We have put safe practices in place for the past year that allow us to provide effective care in a safe way to all the communities. We can see you in person, we can see you through a video visit, but no matter how we see you, we will give you the best possible care in the safest possible way. Lastly, it is important for everyone to get vaccinated. One of my jobs in my daily life is to make sure that my patients have all their vaccines. This is a little different in that I tell patients to get vaccinated, but be patient, because the vaccine can only be supplied, manufactured so fast. But when we do have supply made available through the federal and state government, we hope to get vaccine out to all our eligible patients. And we hope that a point sometime this year, we reach a herd immunity where the pandemic will stop. We do know the 2 vaccines that are on the market now are both 94% effective in preventing disease, which is very, very remarkable. And we do know that there are 2 vaccines ending their clinical trials soon, and hopefully that will help with the supply. So we look forward to the day when we can say COVID-19 is in the rearview mirror. But until then, we need to support our communities, our families, our healthcare workers by having patience in obtaining the vaccine, and most importantly, continuing to adhere to the things we know that have worked, that have bent the curve, the proper protection of each other and ourselves.